You ever stop and think about how we as a society actually stay healthy? I mean, it's not just about doctors and hospitals when we're already sick. Turns out there's this hidden blueprint, a whole master strategy that public health experts use to protect us. And a lot of this work happens long before we even feel a sniffle. So let's pull back the curtain on this master plan, the 5 modes of intervention.
Here's how we're going to break this down. First, we'll get a handle on the overall blueprint for health. Then, we'll dive into how we build our first defenses before anything goes wrong. After that, we'll see what happens when we need to catch a sickness early. And finally, we'll look at how we manage the aftermath. It's really a journey along the entire timeline of a disease. All right, first things first, let's lay the groundwork. The big idea here is that public health isn't about sitting back and waiting for disaster to strike. No, it's a series of deliberate, carefully planned actions, all designed to keep us well from the get-go. Now, at the very heart of this whole strategy is this one word, intervention. And it's way bigger than just medicine. An intervention is literally any attempt to step in and change the expected course of a disease. This could be anything from a public health campaign on TV, to ensuring a town has clean water, to providing social support for someone who's ill. It's a really broad and powerful concept. And these interventions aren't just random. They're organized into these 5 modes that all work together. Think of it like a complete toolkit that public health can use, starting with these huge society-wide actions and moving all the way down to incredibly specific one-on-one care. So let's jump to that first and honestly most important stage, primary prevention. This is all about building a fortress of health before any disease even gets a chance to start. This is where we get the most bang for our buck because we're preventing problems instead of just paying to fix them later on. The very first mode is called health promotion. Now, this isn't about fighting one specific thing, like the flu or measles. Not at all. The goal here is to strengthen the entire population, to make all of us, what experts call the host, more resilient and healthy in general. So how do you do that? Well, you use some of the most fundamental building blocks of a healthy society. You're talking about educating people about health, making sure everyone has access to basics, like safe drinking water, improving nutrition across the board, and encouraging positive changes in lifestyle and behavior. And this right here perfectly illustrates the power of just knowing stuff. The World Health Organization basically says that simply sharing what we know about health is one of the single most cost-effective things we can do. Knowledge itself is a form of prevention. It's that powerful. Okay, so the next layer in our primary defense is specific protection. Now we're getting targeted. This is where we take aim at a particular known enemy and try to stop it in its tracks before it could even get started. And the examples here are going to sound super familiar. Immunization is the classic case, right? A specific defense against a specific virus. But it also includes stuff like workplace safety rules to protect people from on-the-job hazards, or laws that control cancer-causing chemicals in our environment. But let's be realistic. What happens when a disease manages to slip past those first defenses? Well, that's where we enter the next phase, secondary prevention. And this is all about catching the problem as early as humanly possible. The key word here is timing. The disease has technically already started, but we're trying to find it while the changes it's causing are still reversible. Sometimes this is even before a person feels a single symptom. The whole goal is to jump in, intercept the disease's progress, and just dramatically shorten its impact. I absolutely love this analogy. It just perfectly captures the spirit of secondary prevention. You don't wait for the entire house to be engulfed in flames. You find that first tiny little spark and you put it out right then and there. And this approach is an absolute lifesaver for so many conditions. Just think about routine screenings for things like high blood pressure or different types of cancer. Finding these diseases early doesn't just improve someone's chances, it can also prevent them from spreading to other people in the community. It's crucial. Okay, so finally, we have to move to the last stage, tertiary prevention. This is what we do when a disease has already taken hold and progressed. Now our focus has to shift to managing the long-term consequences and trying to improve quality of life. And the tone here really changes, because this is where the human and economic costs of disease can get incredibly high. To really get this, we have to look at this potential chain reaction that public health is trying so desperately to stop. And of course, it all starts with the disease itself. If that disease isn't stopped, it can lead to what's called an impairment. That's the actual loss of a physical or a psychological function.
A good example is nerve damage from a disease like leprosy that causes someone to lose the feeling in their hands.
And from there, an impairment can lead to a disability. This is about what a person can't do as a result of the impairment. So if that nerve damage means someone can no longer grasp objects, that's the disability. And then, the final link in the chain, that disability can become a handicap. This is the big picture social or economic disadvantage that results, like being unable to work. The entire goal of tertiary prevention is to jump in and break this chain at every single link. And this stage really has two key parts. First, there's disability limitation. This uses medical treatments to try and stop an impairment like that nerve damage from becoming a full-blown disability. Then you have rehabilitation, which works to restore function and help a person overcome their disability so it doesn't become a handicap that limits their place in society. What's so interesting here is how broad the idea of rehabilitation actually is. It is not just physical therapy. It's this coordinated effort, this big team up, using medical, social, educational, and even job training measures, all to bring someone back to their highest possible level of function. It's really about treating the whole person. Of course, you've got the medical side, restoring physical function, but just as important is the vocational side, helping someone earn a living again, and the social side, restoring relationships. And maybe most crucial of all, the psychological side, restoring a person's dignity and self-confidence. So let's put it all together now. This summary just lays out the entire system so clearly. You can see exactly how it all progresses. Primary prevention works on the whole population to reduce the number of new cases, the incidence. Secondary prevention targets individuals with the disease to reduce how widespread it is, the prevalence. And finally, tertiary prevention focuses on patients to reduce the long-term complications. It's a complete, multi-layered, and pretty brilliant blueprint for a healthier world. And all of this leaves us with one final, really big thought. We have this clear, logical blueprint. We know how to move from proactive prevention to reactive care. The question for all of us is, where are we actually putting our focus? As a society, are we investing more in building that strong foundation, or are we spending most of our time and our money just making emergency repairs?